seeing here, Nicole says, Dimi, do you host workshops? If so, do you bring the ultrasound machine with you? And what does the demo in the workshop look like? How do you demonstrate the ultrasound while not giving away a full free treatment? So let me answer that, Nicole. So first of all, let me tell you that, yes, we do that. We do events, especially before COVID, we were doing a lot of events, live events. Then we started doing some virtual events. But let me explain to you a little bit more about that, okay? Practically, if you remember, during the workshops, what do? You establish the need of the patient. You ask, the question, whatever, and then you have, you draw, let's say, the shoulder, you draw the knee, you do a little explanation. And then before you do the 1 minute miracle, and Nicole, what I'm referring to when I'm saying the 1 minute miracle, a 1 minute miracle is that in 1 minute you do something with that patient that before and after you can produce a measurable result. Let me give you an example here. You have somebody, you tell them, lift up your shoulder, they lift the shoulder up to, let's say, 70 degrees. You do a first rib manipulation, and then you say, boom, lift up your shoulder, and they can go to 120 degrees right now. Okay, so that is what we call one miracle, like a quick little technique that can show a visual, measurable change to their condition. Okay, before we do that, we ask the patient the following phrase: who would like to see inside your own shoulder? Who would like to look, to see inside your own knee? I can tell you, when you have a room of 30 people, you get 30 hands up in the air. Everybody wants to see inside their body, how it looks, right? So then you do a little demo where you're showing them a couple of pictures of that, and then those pictures coincide what you have drawn on the board. Said, okay, you see that? This is your rotator cuff. You see that black thing? This is a partial tear. This means that there is disruption of those fibers. And you explain that to the patient, and we can do physical therapy for that. And boom, explain to them how to do the physical therapy, or you do the 1 minute miracle. But you tell the patients, in order to find the right problem, in order to provide the right solution, you have to have the right problem. You have to have the source of the problem. And these diagnostic tools, the ultrasound and the electromyography testing, are some of the tools that we are using them in addition to our physical examination to help us derive to the source of your problem and give you the best solution possible. So that's the idea. That's how we do it, Nicole. Now, in terms of an ultrasound screening,
can you hear me?
Yeah.
Sorry. Yeah, I just had a question on that. So whenever you pick that one person and they get to see inside their shoulder, does that person typically schedule an ultrasound, like a full ultrasound session on top of that after, so they can see like their full results? Okay.
Yeah, of course, because what you do there is you just do a couple of shots just to show them, and you explain to them, this is just for demonstration purpose. I'm not doing a full exam on you. I'm just showing a few images as an example to show you how this can be used clinically.
Okay, thank you.